This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
We're going to start with something that we've never heard before here in this area. It's not the heat, it's the humidity. Right? And that's what it is today. Good morning and welcome to the show. Good to have you back with us here. We are live in the studio. Health Watch every Sunday, 8 till 9. Talk Radio 1210, WPHT. As you heard the man say, Dr. Molly FANTASIA is here. She is the PhD doctor, executive director, and founder of Innovative Medical Associates, Marlton, New Jersey. We're going to talk about the who, what, when, where, why, and how of Innovative Medical Associates, how it can help you and any member of your family improve your overall quality of life. And as always, we welcome your participation at 855-839-1210, 855-839-1210. That's the number here in the studio. And in addition to our regular features today, we're going to have a special guest.
We're a very special guest,
That's
certainly
right.
to me.
That's right. And to many people
That's
in the
right.
area. Dr. Harvey Glass, who is a well-known area dermatologist for many years. If you drove down Route 70 in Cherry Hill, you saw the sign, Dr. Harvey Glass, dermatologist. And, of course, Dr. Glass is kind of semi-retired, but he's still active.
He's semi-retired,
Yeah.
but you know what? Yeah, in that he's semi-retired, he's not seeing patients. But I got to tell you, he's still a fount of information.
That's exactly
and
right.
up to date on what's going on, and very, very important to myself and my facility because of all of the input he had on our wonderful skincare products.
And we're going to talk about that with Dr. Glass in a couple of minutes, so stick around for that. And again, 855-839-1210. And we will talk a lot about kind of what it is that Innovative Medical Associates does and how it's different from what you've come to expect from a primary care practice, which it is.
Oh, yeah, it is. It's a facility,
It's
primary
a facility,
care facility.
primary care facility.
Right.
And what is different, Dr. Molly?
Well, first of all, we are a collection or a collective of various healthcare providers, including physicians, who actually work out of our facility. And when I say that most of the healthcare providers who work with me, in fact, all of them, come to this with an understanding that if someone needs primary care, you need a blood pressure med, you need an antibiotic, you need something for cough, you're having a fever, you need something else, we're there to provide that. But what differentiates us from everybody else is if we are able to deliver the hydration therapy and therefore deliver natural substances to augment some of these prescription meds and thereby really cutting some of the side effects of the meds.
What you deliver via IV is natural products.
Sure,
So
sure. Vitamins, minerals.
Yes.
Go to the health food store. You'll
Right.
see. Actually, I have a wonderful guy. You know, I get off on these stories, John, because the stories are fun.
Real, yeah.
And they tell the tale. I have a wonderful gentleman who's in from the burbs in Philly who owns a health food store. Very brilliant guy. He's the kind of guy I love dealing with because he's so knowledgeable about the natural products.
Yeah.
But we don't always get that in the health food store.
Exactly. And you've often said for people to understand the hydration, the amount that you're getting from the hydration bags far exceeds what you could get
Most times, yes.
in the health food store.
Yeah, it's more appropriate dosing is what I'd like to say for a particular patient.
Which is sort of when we've talked about vitamin C, you know, you've talked about that and the getting the vitamin C and the hydration, which I get every week. And people say, "Well, I take vitamin C. I take
know.
1,000 milligrams a day."
Yeah,
And then-
drop in the ocean. Drop in the ocean. And the idea also, John, and I think this is important, what separates us from a lot of quote-unquote spa-like places is our extracts are very, very particular because obviously that's my background. I want the extracts to be appropriate, and I want them to be God's ingredients, natural, truly natural, not manufactured, not adulterated.
Let's talk about the hydration.
Sure.
And talk about Because people still have a bit of a challenge understanding what you do.
I think it's so simple. If today, especially in days like this, if you're feeling fatigued and you're sweating and you have a heat problem, what do? You go into the emergency room, right?
Yeah.
Especially elderly folks. And what's the first thing they do to you?
They hook up a bag.
Exactly right. And this is very similar, except we want to preempt any problems. We don't want you to have heat stroke. We don't want you to be dehydrated. We want to prevent all that. So we have a prevention piece, and then actually my physicians actually have a treatment protocol for folks.
So what you're getting is, in the hydration, you're getting natural products.
Right.
And what people are used to is you go to the doctor, he looks at you and he says, okay, here's a prescription. Go get this filled. Take this and this and this, and then see me in 6 months.
See you in a week, 2 weeks, whatever.
So this is not what you do.
No, absolutely not. First of all, medically, the most wonderful thing about a facility like this is generally people come in for several of the IV therapies. Therefore, we're able to actually watch. I have Gladys Glass, Harvey's wife, actually said something that was extremely important to me. She said, nurses are trained to observe. Well, that's exactly right. When you come into a facility like ours, people on the floor, my gals under the nursing service, are trained to observe. So if we see you look a little more pale or you just don't seem quite right, then we know we can get a medical intervention done rather quickly. There's many reasons to use hydration. Also, the delivery system is exactly at the level that we want to induce.
The delivery system delivers, again, natural products,
Sure,
as opposed to people being used to getting prescriptions. Now, you have doctors on staff who can prescribe
absolutely, and
prescriptions.
And
you've done it for me, and you've done it for a lot of patients.
Of course.
If necessary, and I think your philosophy is, and your clinic's philosophy is, the least amount necessary
to help effectuate the change.
Exactly.
Period.
And so that's the difference, as opposed to what we've been used to.
If we can cut down on the prescription meds, all right, using less of the prescription meds, even in combination. Many times people walk out of the doctor's office with 2 or 3 prescriptions. We're not opposed to that. If you need 2 or 3 drugs, fine. But why not use the least amount of those drugs and see really if we can help, then ultimately maybe reduce one of them out or some variation of that, John. Listen, we're talking in the abstract, but when you come in and you talk to my patients, you'll see exactly how this works. It's pretty simple.
And you've always talked about the initial consultation, which is complimentary, but people can really, and you had one the other day.
Yes.
The gentleman came in, he was talking to everybody.
Right.
And that's really where you can get the information.
Exactly.
Customized to your situation.
Exactly.
That's really.
And everybody in our chair, as you know, by the color, and I love it when you say the color of the bags. Well, yeah. When you see the bags, they're clear, they're brown, there's all kinds of things.
I had orange and yellow this
That's
week.
Right.
You know?
That's right. There's so many things. So again, it really is customized for the patient.
And what can people expect in terms of results? Because and we've gotten the question here on the show.
John,
does it have a track record?
Sure, we have a track record. People generally do better somewhere between 5 and 15 weeks. However, I ask people now, how long did it take you to get into this condition?
Years,
There's
probably.
the answer.
Years.
Because if you've allowed your diabetes to go out of control, if you've been taking all of the injectable meds for all your pain, if you've had this rheumatoid arthritis for 30 years, listen, it's not holy water. It's not going to make the change in 2 treatments.
Well, the interesting thing is, a couple of weeks ago, we had a caller here on the show, and they said, what's the track record? What's the results?
Yeah, right.
And I thought about that question, and I said, you know what the results are? People come back every week.
And they feel better.
And they
That's
feel
why
better,
I said to the gentleman, come in and see. I do not just base what we do on the quantitative data. Yes, we have it. We have laboratory data. We get X-ray. We get radio. Whatever you need, we can get that data. But you know what's really important to me? How you feeling? How's it going?
That's right.
You have less pain? Pain scale is very important to me for people with the arthritis, people with cancer. So there you go, John. That's all I can say.
There's the results right
Yes.
there. Okay.
Yes.
Coming up on our first break of the morning, our show is Health Watch. You'll find us here every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates located in Marlton, New Jersey. We're talking about what they do and how they do it and why they do it at Innovative Medical and how it potentially can help you or any member of your family who has a medical challenge, or if you just want to feel better. Pretty simple. 855-839-1210 is the number here, 855-839-1210. Coming back with more of today's edition of Health Watch after these words. Back here on Health Watch, operators is always standing by while we're here on the show, and they'll be there well after we leave you at 9 o'clock. Operator standing by at Innovative Medical Associates, 856-489-0505, 856-489-0505, Innovative Medical Associates, Marlton, New Jersey. And the website, and this is important because we're going to make reference to a couple of items in a few moments. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com is the website. And our show is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. We are pleased to have on our show. He's been on before, but we're glad to have him back again on the show. He is a renowned dermatologist and area physician, Dr. Harvey Glass, who is on the phone.
And he's a great friend of our clinic. So God bless Harvey for getting up so early. That's why we say semi-retard.
Pleasure to be with
thank
you,
you,
John, and you, Dr. Molly.
That's good. You're the best, Dr.
Listen,
Molly.
I have to share the line that you sent to me in an email the other day. You said to me, John, you need Dr. Molly. I need prosciutto.
We all need prosciutto.
I found that I need both.
Yeah,
you're the best. John.
Exactly.
You're the best.
If I'm to be properly cared for, I actually need both.
That's right.
Amen.
Let's just kind of an overview. I mean, you've known Dr. Molly for like 30 years or more, but I want to get to the part where you kind of reconnected with her. You had a medical challenge a few years ago, and you went to Dr. Molly. I mean, you were in pretty bad shape from what I remember. Can you talk about that for a moment?
Absolutely. I had a problem back in the January, February of 2019, as best as I can recall. At that point, I was unable to swallow or talk. There was no apparent reason for that. I had consulted a ear, nose, and throat specialist, find nothing wrong with my throat other than some swelling of my tonsils, and he referred me to other specialists. I had seen a gastroenterologist, I saw a neurologist, I had all kinds of tests and MRIs and all sorts of things. The bottom line was that I was unable to eat or drink or talk.
I remember.
My wife Gladys might have loved the part where I couldn't talk, but it was very disturbing to me.
Yeah, sure.
She realized that she's a registered nurse, that I was becoming dehydrated.
Right.
And unfortunately, there are very few places available, at least in this area, where one can get intravenous fluids and nutrients. And she said, hey, we got to get to Dr. Molly and fix you up. And that's where it was. And immediately, Dr. Molly got into the picture, and before I knew it, I had intravenous fluids, vitamins, nutrients, and I certainly within minutes I felt better. Eventually, that peculiar condition I had, which nobody was able to diagnose, including myself, disappeared. Fortunately, it hasn't been back since.
And
that's good.
So our relationship at that point was definitely cemented, and I'm glad to be with her and working with her on this skincare situation.
Yeah, I want to get into that now because as a result of that, you kind of both reconnected and started discussions. And I know Dr. Molly was telling me, she said, I'm going to develop some skincare products with Dr. Glass. And really the philosophy and the whole methodology was the same as Dr. Molly, natural products to help with skincare. So can you talk about that and how you both collaborated in putting this together?
It was great. It's great.
Sure. Over the years, in my practice of dermatology, I realized that there was one area that was sorely neglected, and that was maintenance of skin care. We, as physicians, are trained to treat diseases. Unfortunately, the area of maintenance and prevention have largely been ignored until more recently with people like Dr. Molly, who has taken the bit and decided that people need to maintain and care for their bodies and their skin, and therefore it seemed like a natural evolution to get into the skin care. My background is in dermatology, but I also have a degree in pharmacy and have been very active in cosmetic production and formulation over the years. And back in 1972, when I started practice, there was no such thing as real skin care.
Right.
There were a few people from Europe that came over that practiced what was an art rather than a science of skin care, giving facials in their salons and what have you. There was no license per se for skincare specialists, which we call estheticians. Getting beyond that, I felt that Dr. Molly should consider having a line of skincare products to enhance that which she does in her intravenous and vitamin and nutrient supplements, and that's how it started.
Can we
looked around and researched
right.
products and formulations and have come up with what I think is an ideal situation.
Well, Doctor, we're going to just mention to the folks that they can go to the website, innovativemedicalassociates.com, and you'll see a list there of the products, and there are several, and, too many to talk about here. But the point is that I guess this is kind of taking your philosophy and Dr. Molly's philosophy together, skincare coupled with IV therapies. That is, we could say that's a substantial benefit all the way around, couldn't we?
Oh, boy, yes, of course we can. Let Dr. Glass answer that,
yeah.
Of course.
Well, absolutely, but I would go one step further in that there are other nutrients which we cannot deliver intravenously that are taken orally, and Dr. Molly definitely counsels people on those. But the intravenous ones are amazing because they get to the area needed very rapidly. Right. And there's no time to go through the body system. They go where they're needed. And she has a fantastic handle on what you need, how you need it, when you need it, and how much you need. And it's an amazing talent that really amazes me.
Yeah, it amazes me too, because I've seen some cases, and I've been a patient for 20 years. I've seen some cases there, Dr. Glass, that were hopeless when they came in, and when they walked out, they were walking out like nothing ever happened. So you're right, it is an amazing talent.
And so I thought that the clinically inspired skincare that Dr. Glass was so kind enough to impart his counsel and advice was the way to help people look good and feel good at the same time.
Yes.
So I think that's where we were at with this. And there are some products that just blow me away, actually, because the more research that I was lucky enough to do with Dr. Glass, the more excited I am about this line, and I think also the evolution of this as we go along, Dr. Harvey.
You know, Dr. Glass, you were in the office the other day, and it's interesting, and we didn't kind of plan this until later on, that I had scheduled a facial on Tuesday. And then on Thursday, Dr. Glass was in, and he said, well, how do you feel? I said, I feel really good. I mean, it was like shaving was easier, the skin was smoother, and this was all the facial given to me by your esthetician, and it was using these products that we're talking about.
Absolutely.
So, yeah, you remember that, Dr. Glass? You said, how do you feel?
I certainly do, and I really, we started with facials and skincare back in the early 70s.
Right.
And, of course, now that Dr. Amali has really taken the bid on that, they're very beneficial. I think having a relaxing few moments where somebody is tending to you, touching you, and massaging you, particularly your facial area, is extremely beneficial, both physically and psychologically. The benefits of the products are a given. They clean, they deep clean, they tone your skin, and they moisturize your skin so as to allow it to be able to deal with the elements that we're all exposed to, particularly our face. That's our most exposed surface. Unless you're a nudist, it is. So your face is out there all the time.
Yeah.
Even with our current mask thing, your face is still there.
That's right.
Yes,
That's right.
yes.
So,
Well,
And you know what, Dr. Harvey, what's interesting, I'm glad you brought up the mask business. It's been interesting because many of my clients' patients, including one of my docs, actually started using the antioxidant day cream. And it's really been helping, along with the Swiss apple serum. And it's actually helped with, the inflammation from the mask. So, boy, you hit that right on the nose there.
okay, we're coming up on a break. Dr. Glass, you're gonna hang with us for a little bit. Dr. Harvey
I
Glass
will
is our
stand by.
okay.
Thank you,
Dr.
sir.
Harvey Glass is our guest, well-known area dermatologist, and
All-around great guy.
all-around great guy, and chef.
Oh,
and,
yeah.
and prosciutto lover. Dr. Glass will be back with us, and we're going to be talking about what he and Dr. Molly developed as far as the skincare, and I'll talk more about my facial and what I found out. 855-839-1210 is our number here. Our show is Health Watch, Sundays 8 till 9. Talk Radio 1210 WPHT with Dr. Molly Fantasia and our guest, Dr. Harvey Glass. I'm your host, John DeMasi. We return. More of today's Health Watch after these words. Welcome back to Health Watch. Operators standing by right now at Innovative Medical Associates, 856-489-0505. You call that number, and you can ask any question you like if you're a little bashful about coming on the radio. And also, you want to make an appointment to sit down with Dr. Molly, because that's really where you can hone in on what you need or what your situation is, and Dr. Molly can help you with that. And the initial consultation is complimentary. So take advantage of it, 856-489-0505. We've been talking about skincare products, and if you go to the website, innovativemedicalassociates.com, not only do you get more information, but you can also get the complete list of Dr. Molly's skincare products that were developed with the help of Dr. Harvey Glass, who is our guest here on the show today. InnovativeMedicalAssociates.com is the website, InnovativeMedicalAssociates.com. And our show is Health Watch, as I said, every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Harvey Glass is our guest. As I said, he has developed, with Dr. Molly, the complete line of skincare products. You know, I got to tell you, Dr. Glass, I had the facial this week, and you were talking about the face and how it's always out there and it's exposed. And the esthetician used this, this little device on the face to kind of cleanse. And she showed me, she said, look, this is all the dead skin that was on your face. And it was quite a bit. And I guess that's something that you were kind of referring to, but people aren't aware of something like that, are they?
Probably not. I mean, we are exposed, and we constantly build up dead skin cells, which the esthetician was certainly able to remove. Excuse me one moment. Most people can do a pretty adequate job of cleansing themselves using products like the ones we developed with Dr. Molly. I should point out that there are thousands of products out on the market that claim miraculous results. Be aware of the fact that there are no miracles, that it takes time and effort and the right products and the right ingredients to achieve good results, particularly in the areas of anti-aging and skin cleansing and so on.
You know, you're mentioning this, and I'm thinking about, you ever notice, like, especially if you can't sleep at night, you turn on the TV, and every channel has an infomercial about skincare and the miracle of this particular product,
Right.
that it's going to take 10, 20 years off your life. I mean,
Yeah.
Instantly.
yes.
Yes. I think that's our whole problem, Dr. Harvey. We, as Americans at least, we think everything, leave the doctor's office with a prescription, it's going to work immediately, the world is going to be your oyster. That's true for this stuff, We have to realize, I mean, you see this, and I see this every day with the hydrating natural products. It takes time. Tincture of time, right? I mean, that's the deal.
Yeah, and the logical question. Go ahead, Doc. Go ahead.
Religious application of the products
Right.
at the right time in the right way, and I think your staff, Molly, have shown these people how to do this stuff properly.
Yeah,
And that's important.
I agree.
Training on how to properly use the products is very important. Now, it's obvious to me that a lot of people will still try other products
Of course.
listed on those infomercials. They spend a lot of money for products that are probably either useless or certainly not in the same league as Dr. Molly's products. So, coupled with training by her staff and the proper use of the proper products is very important in helping to maintain healthy skin care.
You touched on this earlier, and I'd like you to kind of elaborate a little bit more. Why is there the need for skin care? And let's give people expectations from these particular products that you and Dr. Molly developed. What can they expect from these products?
Well, I think what they can expect, as they can from other treatments afforded by Dr. Molly, is not only to help maintain healthy skin in terms of cleansing, moisturization, prevention of the elements from attacking our skin, which is first and foremost out there. So that's where it's really at, to learn how to use the products, to use the products, and don't expect miracles.
Right.
These things take time, and just like we need nutrients, we need skin care on a regular basis.
So I guess the message here, Dr. Glass, is get the skincare products and then use the hydration therapies that Dr. Molly has to offer.
And also, you continue to use the skincare products
Yes.
on a regular basis.
Right.
I mean, we're always defending against free radical damage, whether it's internal or external. Our skin is the largest. I hope, Dr. Glass, we still, like the old girl that I am, believe that the skin is the largest organ. I've heard there's some
It most certainly
controversy.
is.
That's what I feel. And, we should treat it as such. And I think that there's been a lot of folks that go in and get all of these, products and don't even know what's in it and just, apply it sort of haphazardly, and it's like everything else. I think we have to get into a routine. So I'm with you, Doc. I appreciate you so much, and my nurses love you, Dr. Glass, because they're using the product. And, lovely Linda and Crystal and Jess are all using the product.
Yeah.
So they're seeing the difference, and they're able to tell that to the patients.
And I talked to a patient the other day. She had gotten a facial. I got one Tuesday.
Yes.
She got one last week.
Yes.
And said the same thing. She said it really felt great. And the skin, like shaving, we shave every day.
Of
Men
course,
shave
of
every day.
course, of
And
course.
shaving was like easier, and it's been easier. And you could just feel that the skin is smoother, and it just feels better.
Amen.
So
that's all I can ask for.
But these are, again, Dr. Glass, this is the same philosophy that Dr. Molly uses, natural products
Right.
to help with
I was
skin care.
going to touch upon that.
Okay.
And the ingredients that you would find in these products, and they're listed on the label on each of the products, are absolutely as natural as you could possibly get. There are no noxious materials, no toxic materials. They've been carefully formulated and contain only those ingredients which are beneficial to the skin. As time goes on, we learn more and more about other things, natural products, and ingredients that are excellent for skin care. And those will be incorporated and are incorporated in Dr. Molly's skincare products.
It certainly has been a very valuable piece to Dr. Molly's practice.
Absolutely.
And we certainly thank you for coming on early. I'm still waiting for, I know Cioppino is your specialty, all right?
Well,
we can't get away from food, can we,
Exactly.
Dr. Harv?
I mean,
I hope not.
No, we never will. Quality of life, man.
yeah.
That's what it's
Well,
all
yeah.
about.
When you're prevented from one of the major pleasures in life, at least
Right.
as far as I'm concerned, as I was, you realize how important that is.
Amen.
It's a body and soul and psyche thing.
Exactly.
You got to have your food, you got to have your skin care, you got to have your medical care.
Right.
It's the whole thing wrapped up, and fortunately, we have people like Dr. Molly out there that sees the whole picture.
Yeah, yeah.
As physicians, we're traditionally trained to treat disease.
Right.
We don't look at the maintenance and of good health. Only recently, I say maybe over the last 10, 20 years, are we beginning to realize that, there's more to medical care than just trying to fix the disease.
Yeah,
I'm so lucky in knowing physicians like yourself, Harvey, and like Dr. Vivian, like Dr. Testa, and all the wonderful physicians that have come through to just see what we're doing and how we do it, who really are picking up the interest in keeping the prevention in mind, as well as, keeping the quality of life issues right up front along with the medical issues. So
Dr.
God
Glass,
bless you. And
Thank
I
you.
mean
Thank you for coming on. We appreciate you getting up early and hanging with us
I
here
didn't
on
get
the
up
program.
early. I got up at 6 a.m.
Okay.
I have to milk the chickens and feed the cows.
he has to light the oven. Come on.
That's right.
He's
Okay.
doing it. Thanks, Doc. God bless you, brother.
Dr. Glass, thank you very
Take
much
care.
and continued
Thank you,
success.
guys.
And
Thank you.
We look
Thank
forward
you.
to having
We'll
you
be
back
in
on
touch.
the show.
As a matter
All
of
right.
fact,
you.
I'm going to make an appointment for a facial.
All
Yeah,
right.
okay.
Thank you, buddy. Bye.
Thanks a lot for the call.
Thank you. And there it is.
Yeah,
I mean,
it's
I'm so lucky, John. This I really feel so much gratitude to Dr. Harvey for helping me with this line. I can't tell you, because he took the philosophy of what I was saying. We played with the products, and in the end, I think we came up with some good ones that actually use the same ingredients that I use in the IV bags.
Right. And if you want to get a list,
sure, call.
you go to
It's
the
on the
It's on the website,
Yeah.
innovativemedicalassociates.com. You'll see the complete line of skincare products.
Right.
And certainly feel free to order as you see fit. InnovativeMedicalAssociates.com is the website. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, executive director, and founder of Innovative Medical Associates. A couple minutes left of the show. If you want to jump in with a question for Dr. Molly about the skincare, about anything, 855-839-1210. Coming back with more of today's Health Watch after these words. And we're back here on Health Watch. As always, operators standing by at Innovative Medical Associates. In fact, they will be there well after we leave you at 9 o'clock. You can call right now, get more information, or you want to set up that initial consultation with Dr. Molly, 856-489-0505. A lot of folks have come in who listen to us here on the show, 856-489-0505. The other day, you had a consult, and he said, well, my mother's realtor was listening.
This was great.
Yeah, that was great. My mother's realtor was listening, and then he told my mother, who told me that I should go in and see Dr. Molly. So, I mean, however we get there.
It's true. And this poor gentleman, he's a real nice young man, and he does landscaping. And I'm seeing more and more of Lyme patients.
Yeah.
And, it's probably the time of the year, John, but I find that it's very disappointing that traditionalists are still telling people they don't have Lyme just because the Lyme titer comes back negative. Many times when you get the history down and you hear the problems that they've been having since the Lyme bite, and maybe these problems develop many months later, but when you put the puzzle pieces together, they're having some type of post-Lyme syndrome. And they're the joint pain, the neuroendocrine piece where maybe the hormones are dysregulated, and also brain fog. This young guy had all of those things. Do I think we can help him? Yes. Do I think it's holy water and we're going to help him in 2 treatments? No. I think exactly what Dr. Glass was saying. It's a question of regularity, and it's about coming in and doing this. But I'm seeing more and more of this post-Lyme, and people don't understand. The tick, it's in the bite itself. The tick delivers these viruses, this bacteria, and that's what's causing the havoc.
So what you said was the test after the Lyme.
Yeah, might say negative.
Does not come up that there's issues.
Right, and that can happen because maybe the body hasn't made the antibodies yet. Just like with the COVID test. Oh, well, you had COVID, but we can't find the antibodies, or they're not there. Yeah, they'll be there. It's just sometimes the body takes time to develop this, which is a measurable type thing. But in the meantime, the patient is suffering from the post-Lyme symptoms, and that's where we jump right in. I believe this.
Okay, we want to mention our website, InnovativeMedicalAssociates.com. Get more information on that. And also, we've been talking about the skincare products. Complete list of that on the website as well. And you could purchase right from the website. InnovativeMedicalAssociates.com is the website. And also, don't forget, we have our Health Watch replay this afternoon, 4 to 5. So if you miss any of today's show, you want to hear it again, 4 to 5 this afternoon, our Health Watch replay here on Talk Radio 1210 WPHT. A couple of minutes left of the show. If you want to jump in with a question for Dr. Molly, 855-839-1210. 855-839-1210. You have seen this week a glut of cases of Lyme.
Yes, I have several people in the chair for it.
And again, a lot of traditionally treatments,
or they've been dismissed traditionally. I say that's really the deal.
Yeah,
and don't take that as gospel. Let's find out.
And in this case, you talked about this patient for the consult. He was talking to me.
Yeah.
He's a landscaper.
Right.
Well,
right.
I mean, is he a prime candidate for that?
Absolutely. But the point is, just because the quantitative data says no doesn't mean you don't have symptoms of this. You don't have the post-Lyme disease. I say get in. Let's talk about it. Let's see what we need to put together and put the Lyme protocol together for you. And everybody who has this post-Lyme doesn't necessarily have the same symptoms, but they have a lot of certain symptoms and not so much of the other. You got to put the mystery together. That's the point.
And what can be the expectations as far as?
Probably feeling better, less fatigue, less joint pain, less mental depression, and less brain fog. I would say that's a win.
How many treatments,
In
roughly?
his case, just talking to this young man, I would say 15 treatments minimal.
At least, right?
Right. Right.
And so-
and it may be more.
Right. And then maybe once a week, twice a week, whatever.
Right, once
Yeah,
a week, and we see how well we do. But I think he could start to see changes in as little as 5 weeks.
Now, you use, your protocols are unique.
Yes.
You have over 600. What are some of the things? I know you can't give out,
Listen,
what-
know vitamin C's in there. You know
Right,
that.
yeah.
It's in a lot of things. But the extract might be a little different for someone like him. He probably needs more of the energetic portion of the vitamin C, meaning the sugar molecule. I'm very fussy what vitamin C we use. Sometimes it's beets. Sometimes it's manufactured. Most times it's tapioca, in particular for people with the cancers, that kind of thing. I want to limit the sugars.
By the way, congratulations.
25 years.
25 years. And also,
October.
your next book is coming out on August 1st.
August 1st.
How about that, huh?
Yes. That'll be available on Amazon and I hope on the web in the print version August 1st. We might actually have the Kindle version out pretty quickly.
Oh, okay. I hope I'm in this book.
Oh, everybody. There's a lot of interesting things in this book.
I've been asking you for 2 years to get in the book.
Yeah, I know. It's interesting, John. The book has allowed me to go back on some of the cases and really look at them and see where the people are now, because some of them are still with me.
Yes, I know.
And that's really gratifying for me to see their quality of life improve so much.
And you've had some cases that were really serious.
Sure. And since that time, I've had more cases that are really serious. And the thing about it is, remember, quality of life, as Dr. Glass pointed out on his last call, is something where you want to enjoy the things that you enjoy, whether it's the cooking or the eating in many cases, but you want to enjoy life. And that's it. You find out what the patient loves to do.
Well, look at his situation. He couldn't swallow and he couldn't talk.
And there's a guy who loves to cook, okay?
And loves to talk.
Right.
And couldn't do either.
Right.
I mean, there was talk about a serious case.
Right.
There was another one.
Right. And I mean, we see this every day. And I got to thank my nursing staff, everybody on the nursing service, because they do a wonderful job with the patients, whether it's, addressing their needs and trying to be very cognizant of each and every patient's needs and wants.
Well, we'll certainly keep you posted as soon as the book comes out.
Thank you.
Is August 1st. It's available. It'll be available on Amazon.
And Kindle.
Kindle.
Yes.
Dr. Molly Fantasia.
Thank
That's going to put the wraps on another edition of Health Watch. Don't forget, operators standing by. They'll be there well after we leave you at 9 o'clock. 856-489-0505. 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. We talked about the skincare line throughout the course of the show. You can go to the website and get the complete list, and you can purchase as you see fit. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, Joanne, and our nurses Jess and Crystal, I'm your host, John DeMasi. Oh, don't forget our Health Watch replay this afternoon 4 until 5 here on Talk Radio 1210 WPHT. Have yourself a great week, a safe, a happy, and a healthy one. We'll do it all over again next Sunday. Health Watch, 8 till 9, Talk Radio 1210 WPHT. You take care.